Hi and welcome, and today's video is all about diaphragmatic breathing. So when you hear the term diaphragmatic breathing, you might be wondering what exactly it is. So in easy terms, it's the natural breathing of newborn babies and sleeping adults. Breathing is a fundamental necessity of life because with each breath of air that you take in, you obtain oxygen, and then on the release of that breath, you get rid of the waste product, carbon dioxide. So when we have poor breathing habits, it actually lessens the flow of these gases to and from the body, which make it harder for you to cope with any stressful situation. Our breathing here tends to be shallow and is often rapid or irregular. And this type of breathing can actually contribute to your anxieties, panic attacks. It might contribute to your depression, or especially like muscle tension that we might be experiencing, or even headaches. So when we breathe diaphragmatically, we take air in down into our lungs. And as we do, the abdomen then expands, and the diaphragm, which is the sheet of muscle which lays underneath the rib cage, and this muscle actually is a barrier between the lungs and any organs of the abdominal cavity. So this diaphragm, it contracts downwards, which allows more expansion of the lungs. Then when we exhale, the abdomen and the diaphragm relax, which then the diaphragm raises back up. This type of breathing is deeper, slower, and even more rhythmic and relaxing. It also allows the respiratory system to do its job of producing energy from the oxygen that we've taken in and the removal of waste products. So when we become aware of the way that we breathe, we can then start making the shift from shallow breathing, which we tend to do in the upper chest, to abdominal breathing. And as we do this, we then start to rebalance the oxygen and the carbon dioxide levels within our body, which then also helps to normalize our heart rate, and it helps to reduce that muscle tension and that anxiety. So together, if you get yourself seated comfortably, preferably sitting in a straight position, but also try to be as relaxed as you can. We're just going to go through this type of breathing with you, okay? So what I would like you to do first of all is to place one hand on your abdomen and the other hand on your chest, and just breathe normally, as if you would, if I haven't been talking about this. Just breathe, just to see whether your movement is more in the upper chest or whether you are actually breathing from your abdomen. Okay. So just take a little while just to focus on which way that you're breathing at this moment. Okay, so what I'd like you to do now is to take in a slow, deep breath that fills your abdomen up, keeping your hand on your tummy so that you can feel the rise and fall. Okay. We generally say to breathe in through the nose and out through the mouth. So we just do this for 2 or 3 repetitions. So we're breathing in and out. Breathing in and breathing out. Okay, and this is just so that you can get used to a deeper way of breathing, but it also helps to get your body and your breath into a rhythm. Okay. So on the next part, when we take a deep breath in, I'm just going to tell you what we're going to do first because I can't do it and talk at the same time. So when the next time we take a deep breath in, we're going to take it in so that our tummy fills out first. And then as we take in that deeper breath, our lower chest will rise, and then finally raising the upper chest. Okay. Then when we exhale by deflating the upper chest first, then the lower chest, and finally the abdomen. Okay. And we're going to do this for 3 or 4 repetitions. So if we breathe in, we fill out the tummy, lower chest, and upper chest. Hold and exhale by deflating the upper chest first, lower chest, and finally the abdomen. Inhaling, filling up the tummy, lower chest, and upper chest. Exhale first by deflating the upper chest, lower chest, and squeezing out that last bit of air from the abdomen. Breathing in, filling out the abdomen, lower chest, and upper chest. Exhaling by deflating the upper chest, lower chest, and finally the abdomen. Well done. You can carry on. It's a really good idea to start your day with just 5 minutes of this way of breathing, because it will not only give you that energy to start the day from the fresh oxygen, but it will also help to rid your body of any stale air that may be in your lower lungs. And again, 5 minutes before going to bed, because this is a really good tool to help aid relaxation, especially if you have trouble going to sleep at night. It only focuses the mind as well. So if you are a worrier at night time, by doing this breathing exercise after you've done all your nighttime routine and you've got into bed, it does actually help you to fall asleep. Okay, so when you've got accustomed to this way of breathing for 5 minutes at the beginning and end of each day, try to increase this to 10 minutes and then eventually working up to 20 minutes at the beginning and end of each day. But this is also a good exercise if you find yourself in a stressful situation, or if you find yourself worrying throughout the day. Just refocus on your breathing. This will allow you to just for a few moments to gather yourself together, or it may help you to get a clearer mind on whatever is going on in your life at that time, before your anxiety starts to take hold and ending up with you losing control, or you're ending up having a panic attack. Okay, so good luck and keep practicing. Make it part of your everyday life. And I hope this little video has been of some help. So have a go, and please comment on how you get on and whether you found it beneficial, and please do share with others who you may think may find this helpful. Until next time, take care.